Hi, can I come in?
Yes.
All right. Hi there, my name is Anna. I'll be your nurse for today. Very nice to meet you. Privacy. Can you tell me your full name and date of birth for me, please?
Yeah, Melissa Sorrell, date of birth February 3rd, 2004.
Okay. And do you know why we're here today?
Yeah, to do vital signs and a full head to toe.
Okay. Do you know who the president is?
Yeah, Donald Trump.
All right. So patient is alert and oriented times 3. I'm going to start off by taking your vital signs. So can I have your index finger, please? Or middle. That's fine too. I'm going to go ahead and start wrapping this cuff around. Just a few questions to start off. Any allergies to food or medication?
No.
Any family history of any chronic diseases?
No.
Diabetes, hypertension, heart failure? Okay. Any personal history of any of those diseases?
No.
Okay. Any underlying concerns that you want to talk about today with the physician?
No, I have no pain. No.
Okay. I'm gonna put this under the. Okay. Relax your arm for me. I'm gonna go ahead and start taking your blood pressure. All right. So far I can see that your blood pressure is 117/78, which is looking pretty good. And I can see that your oxygen is also at a 98%, which is also good within range. I'm gonna go ahead and start taking a pulse on you and also take some respiration rates. Move your wrist. At this point, I would take the pulse for about 60 seconds and also look at your respiration rates for 60 seconds. Your normal respiration rate is about 16 breaths per minute, and your pulse is 76 beats per minute. So now I'm gonna go ahead and take a quick temperature on you, okay? Under your tongue. Okay, 96.3, which is within normal range. You have good body temperature at the moment. Now that I am assessing body temperature, I'm going to palpate your body just to make sure the temperature is evenly distributed. So I'm going to go ahead and touch your face if that's okay. 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 Okay, upper lower extremities are nice and even to temperature. And face is also nice temperature as well. I'm going to go ahead and start the assessment off by palpating your head for any lumps or discharge. Just from the visual look of it, I don't see any discharge, lumps, edema, no central cyanosis spotted, no peripheral cyanosis. Everything's looking nice and normal. And I'm gonna go ahead and palpate. Okay, no palpated lumps felt. Now I'm gonna go ahead and start taking a look at your eyes. So look straight ahead for me. Okay, both eyes have the pupils equal, round, reactive to light and accommodation. Now I'm gonna go ahead and keep testing your eyes by having you cover one of your eyes for me, please. And I'm gonna test your peripheral vision first, okay? So let me know when you see it.
I can see. I can see. I can see.
Other eye?
I can see. I can see. I can see. Yeah, I can see.
All right. Now I'm gonna have you put your index finger on your nose and touch my pen light as many times as you can. Okay, so coordination's nice and even. I can see that your eyes were following the pen light evenly. Now I'm gonna test you 6 cardinal signs within your eye movement, okay? So follow the pen, do not move your head for me, please. Okay, so eyes were moving without difficulty. I don't see any twitching, sclera is nice and white. And I'm gonna go ahead and check your conjunctiva. Okay, nice and moist. I don't see any discharge fluid or any abnormalities there. Now I'm gonna go ahead and check your nasal for the same thing. I always use my pen light. Okay. So just go ahead and look up for me, please. I'm gonna look inside your nose. Okay, nice pink, moist. I don't see any discharge or abnormalities, and I'm gonna palpate your sinuses for inflammation. Okay. No inflammation there. Did you feel any pain when I was doing that? Okay. So now I'm gonna go ahead and test your mouth. Okay. I'm just gonna go ahead and take a look. Just open real wide for me and say ah. Okay. Stick out your tongue for me as much as you can, and I'm gonna check your tonsils. Okay. I can see that your tonsils are a grade 3+, and oral mucosa is nice, moist, no lesions, no abnormalities. I'm gonna dispose of this. and tongue movement is nice and even. I don't see any difficulties there. Now I'm gonna go ahead and look at your ears. I can see that your ears are nice and symmetrical. Upon palpation, no lumps or any visibilities there.
Mm-hmm.
And I'm gonna go ahead and do a little bit of a test on your ears. So I'm gonna go ahead and do a whisper test on you first. Okay, I'm gonna whisper something. Tell me what you hear.
Strawberry.
Okay.
Purple.
All right. Now I'm gonna be doing the Ryan and Weber test. The Ryan test, I'll be testing it next to your ear and behind your ear on both sides. Okay.
I can hear it.
Can you hear it? Okay.
Mm-hmm.
Back side.
And I can hear. I hear it louder.
Which do you
next to
hear
my-
louder?
Next to my ear.
Okay. Next side.
Mhm. I can hear it.
Mhm.
If it's louder next to my ear.
Okay.
Mhm.
And now I'm gonna do in the middle of your head now. Let me know if it's evenly distributed or louder on one side.
In the middle.
Okay.
Mhm.
Gotcha. All right. So everything with hearing is nice and even. I'm gonna go ahead and start testing for facial sensation now. So go ahead and close your eyes for me, and I'm gonna have you tell me if it's either sharp or dull.
Sharp. Dull. Sharp.
Okay. I'm doing your upper extremities as well. Keep your eyes closed.
Sharp. Sharp.
Okay.
Dull. Sharp. Mhm.
Okay. So I see sensation within upper, lower extremities or even in face. I'm gonna have you test your facial movements. Okay. So puff up your cheeks for me.
Mhm.
Smile. Squint.
Mhm.
Okay. And now I'll have you move your head up and down for me, side to side.
Mhm.
All right. Facial movements are nice and even, no difficulty spotted. So now I'm gonna take a look at your neck.
Mhm.
I'm gonna have you go ahead and look up for me. I'm gonna palpate your lymph nodes. Okay. No inflammation palpated. Then I'm gonna have you turn to the side for me and palpate your thyroid gland. Okay. Turn your head to the side and swallow. Other side. Okay. Then I'm gonna push it against your shoulders and just want you to go ahead and push against me, okay? Good. Now I'm gonna go ahead and check for skin turgor. Okay? No tenting. That means you're very well hydrated at the moment, so that's very good. Now I'm gonna go ahead and check for JVD at the moment, so jugular vein distension. I don't see any visible jugular vein distension at the moment, so now I'm gonna go ahead and go into the cardiovascular system. So I'm just inspecting, everything looks good. I'm gonna go ahead and auscultate your heart sounds, okay? Okay, I'm gonna auscultate apical pulse. Okay, now I'm gonna auscultate the jugular veins. The carotid arteries. Okay, now that I auscultated the arteries and the heart sounds, I'm gonna palpate all your pulses, okay? So I'm gonna start with the carotid pulse. Temporal. Brachial. Okay, I did radial already, but just checking for both sides to make sure it's even. I would check for femoral and inguinal in case of the provider needed it, but I'm going behind your popliteal now. Dorsal pedis. And then posterior tibialis. And then I'm gonna go ahead and check for capillary refill, okay? So can I get your nails? Okay. So capillary refill less than 2 seconds. Everything's looking good for cardio. I'm gonna go ahead and move into your respiratory system now. And I'm gonna go ahead and inspect, and I'm gonna palpate. Okay, percuss. And I'm gonna go ahead and auscultate your breath sounds as well. Okay, now I'm gonna check for symmetrical expansion. So I'm gonna go ahead and press under your chest, and I want you to take 2 deep breaths in, okay? Okay, expansion is nice and symmetrical on that side, and then I'm actually gonna check for tactile femoris on the front side. So every time I press on you, say 99.
99.
Okay, I'm gonna have you turn around, and I'm gonna do the same exact thing on the back side. So everything's looking nice and normal. Gonna palpate, percuss, and auscultate. Okay, lift up your arm. I'm gonna do the 3 on the right side for your right lobes, 2 on the left lobes. And I'm also gonna check for symmetrical expansion. Take a deep breath in when I press. One more time. And then I'll do tactile femoris again. Say 99 when I press. 99, 99, 99. Okay. Everything's looking nice and good for your respiratory system at the moment. So now I'm gonna move over to your abdominal system, okay? I'm gonna lay you down. And just lay back. Any pain when moving at all?
No.
Okay. So can I go ahead and expose your belly? All right, so upon inspection, I see that the abdomen area is nice and even, hair evenly distributed. Now I'm gonna go ahead and auscultate your abdomen, okay? I'm gonna auscultate on all 4 regions. Now I'm gonna auscultate your main arteries. I'm gonna go ahead and do your aorta, renal, iliac, and your femoral, which is a little bit lower on the side. Okay. I don't hear any swishing of the arteries, so everything's sounding good so far. And bowel movements are heard in about 3 quadrants. I don't hear anything on your lower right at the moment, but everything's nice and normal. So I'm gonna go ahead and percuss. Light palpation. Now deep palpation. And is it okay if I palpate your bladder?
Yeah.
Okay. Okay. You can go ahead and do that for me, please. And then actually I'm just gonna raise you up just a little bit to do a little bit of a neural exam on you. Okay. Okay. Right there. So what I'm gonna have you do is I'm gonna have you move your heel from your up, down 3 times, heel to shin, okay? Same thing.
2, 3.
Okay, now I'll have you sit up. Alright, so now I'm going to go ahead and test for your rapid movements. So I'm going to go ahead and have you just in, out very fast for 6 seconds. Okay, same thing with your feet. Okay, you can go ahead and sit back down. Then I'll have you close your eyes and I want you to see if you can interpret what I hand you in your hands, okay? Close your eyes, hand out. What is that?
The tech depressor.
Okay.
Or a little cotton ball.
Yes, cotton ball. And then I'm gonna write something on your hand, and I want to see if we can identify it.
Okay. 8.
Okay.
9.
Yes. Okay. So you can go ahead and open your eyes. I'm gonna go ahead and start checking for your reflexes. So I'm gonna go ahead and go on your biceps. You can relax your arm on my arm. Ready? Okay. Okay. Now I'm gonna do your popliteal reflexes. Okay. Okay. So I see that reflexes are nice and evenly distributed upper and lower extremities. So then I'm gonna have you stand up for me, please. And actually, if you don't mind walking back and forth from the curtain to me, you can stand right there for me. So I can see that the gait is nice and even. I don't see any difficulties. I'm gonna perform a Romberg test on you. So I'll have you close your eyes and then I'll have you just stand there for a few seconds. Okay? No visible swing, no difficulties. Your coordination and balance look really nice. Then I'm gonna go ahead and check out your range of motion for your whole body. So do you mind squatting for me? Okay. Can you rotate your arms like this? Okay, up, down, side to side for the hips.
Yeah.
Okay. You can go ahead and have a seat for me, please. Of course. All right. So now that we did the head to toe examination, your provider should be in shortly to see you. I'm just gonna go ahead and place everything back to its normal positioning. And do you have any concerns for me? Anything you
No.
want to bring up? Okay. And then I'm going to do hand hygiene. Place the call bell right next to you in case you need it. In case you do need anything, my name is Anna. Just let me know in case you do. And they should be able to see you shortly.
Thank you.
Of course.
Okay, here is the room. Alrighty. Just make sure you can see them. Okay. Perfect. So I'm going to provide privacy, hand hygiene. Hi, my name is Sarah, and I'm going to be your nurse for today. I'm going to be doing a head-to-toe assessment on you. Can you please clarify your name and date of birth?
Shelby Cowley, June 20th, 2005.
Perfect. So first I'm going to be doing a nose, mouth, and throat assessment. So when looking at her face is symmetrical. And when looking at her nose is symmetrical and midline. So then next I'm going to palpate the maxillary and frontal. Was any of that tender at all? Okay, then I'm going to palpate the nose and see if there's any masses or lesions. Is any of that tender? Perfect, and there's no masses, nodules, or lesions on the nose. Then I'm going to have you occlude one nostril and breathe in. Good, other one. Good, both nostrils are patent. So now I'm going to look at her lips. Her lips are pink and moist, and there's no crackling. Then I'm going to look in her mouth. Open up, please. All right, the pharynx is moist and pink. The uvula is moist and pink and midline. And then can you say ah? Perfect, and it rises with phonation. The tonsils are a grade 2, and the buccal, and they're also pink and moist. And the buccal mucosa is pink and moist. And then can you stick your tongue out? And then rise it to the top and then down. Perfect. The tongue is midline, and there is no fungi, masses, or lesions or anything like that. And then can you smile for me? Perfect. Okay. Teeth are straight and white and adhere to the gums. And the gums are pink and there are no dental caries. Perfect. So now I'm going to be doing an eye and ear assessment. So when previously I had tested my patient's distant vision using the Snellen chart, and left and right eye were 20/20 vision without corrective lenses, and cranial nerve 2 was tested and intact. And then I also tested her near vision using the Rosenbaum chart, and left and right eye were 20/20 vision without corrective lenses, and cranial nerve 2 was also tested and intact. So now I'm going to be checking her 6 cardinal fields of gaze. So just follow the tip of this with your eyes. Just follow your eyes. Perfect. Okay, so cranial nerves 3, 4, and 6 were tested, and they were all intact, and there was no nystagmus present. So next, I'm going to have you pull down your lower eyelids. Conjunctiva is pink and clear. The iris is green. The sclera is white, and the cornea is clear and smooth. And then eyebrows are symmetrical, and there is even hair distribution, and they are brown. And then the upper and lower eyelids, there is no redness or edema. And then the eyelashes are curved upwards, and there is even hair distribution there. And then I'm going to palpate the lacrimal apparatus, the bone orbit, and then the eyebrows. Is any of that tender at all? Perfect. And there is no discharge from the lacrimal apparatus. So next, I'm going to test your, look at your pupil size. Okay, perfect. Pupils are 3 millimeters, and I'm going to test your activity, so just look forward for me. Perfect. Perfect, and then follow the tip of this. Alright, so pupils react to light bilaterally, and they also accommodate, and cranial nerve 3 was tested there and intact. So now I'm going to look at your ears. Can you put your hair behind your ears for me? Thank you. Okay, so ears are pink, which is proper for ethnicity. There are no lesions on either ear. They are symmetrical, and the tops of the ears are even with the eyes. I'm then gonna check for any discharge or cerumen. None. All right, and then there was no discharge or cerumen noted in each ear. Okay, then I'm gonna have you turn that way, and I'm gonna test your hearing. So raise whatever hand you hear on. I guess and close your eyes. Perfect. Perfect. Okay. So cranial nerve 8 was tested and intact. So now I'm going to be doing a skin assessment. Can you look? Perfect. Okay, so when looking at the skin is pink and tan, which is proper for the patient's ethnicity. It is dry and there is no lesions or any apparent edema. I'm then going to palpate the skin. Skin is warm, dry, smooth in both the upper and lower extremities. I'm then going to check for skin turgor on both hands. All right, skin turgor is less than 2 seconds and is brisk. All right, so now I'm going to be looking at a lesion. Let's do that one. So the border is symmetrical. Well, yeah, it's symmetrical. The color is brown. It has even borders. The diameter, I'm using a little thing here. The diameter is like 1 millimeter, and has it evolved at all over the years? No? Okay, perfect. So then I'm gonna look at your hair. Hair is brown, wavy, evenly distributed, and then I'm going to look behind the ears. Good. For parasites. Good. And then I'm gonna go this way. Sorry, I just told you that. And then behind the hair. All right, and there is no parasites present. Okay, then I'm gonna take a look at your fingers. Beds are pink and smooth and curved. Let's check the toes. Same thing on the toes. I'm gonna check for capillary flow. Breast skin under 2 seconds and touch your toes. Breast skin under 2 seconds, and then I'm gonna check for clubbing. All right, and there is no clubbing for that either. Perfect. So then I'm going to look at her neck, and it is symmetrical, and there does not appear to be any swelling, masses, or nodules. So now I'm going to be doing the heart and vessels, and neck vessels. So when looking at her neck, the carotid arteries, they are symmetrical, and there is no bulging. I'm next going to auscultate with my bowel side of my stethoscope. And when I do it, can you hold your breath for me? All right, if you can take a breath. All right, and other side. Good, okay. There are no aortic bruits heard bilaterally on either side. I'm next going to palpate the pericardium on the chest wall. Is any of that tender or anything like that? Okay, perfect. So now I'm going to listen to the heart sounds on the front. So I'm first going to listen to the aortic, then pulmonary, then Erb's point, then tricuspid, then mitral, and I'm going to first listen with my diaphragm. Aortic, pulmonary, Erb's point, tricuspid, and then mitral, and then I'm going to listen with the bell side as well. Sorry, there. Oh, aortic, then pulmonary, Erb's point, tricuspid, and then mitral. Alright, so I did not hear any bruise heart murmurs or any extra heart sounds. I heard the S1 at the apex and the S2 at the base. And if I had heard any aortic breeze or any heart murmurs, then I would listen to the apical pulse for 1 minute. Now I'm going to be doing the thorax and lungs. So to get the respiration rate, I would count her respirations for 30 seconds and then multiply that by 2. I'm next going to look at her orientation. So can you please tell me your name?
Jonna.
Perfect. Your date of birth.
June 20th, 2009.
Where you are right now.
Delta Zeta.
And then what year is it?
2025.
Perfect. Okay, so alert. She is alert and oriented times 4. She is relaxed. There's no cyanosis apparent on the nose or lips. And yeah, she's relaxed and she's not distressed. And then can you step just a little bit? I'm gonna check her AP to transverse ratio. Perfect. AP to transverse ratio is 1 to 2. Her chest is elliptical, and then I'm going to check her costovertebral angle. Perfect. It is less than 90, and there is no tripoding occurring. Okay, so now I'm going to take a listen to your breath sounds. Yes. Okay, so I'm going to use the diaphragm, and when you turn that way a little so you can see. Okay. And then when you feel the diaphragm, just take a deep breath. Okay. Perfect. And then on the back. Wait, put both of your knees on the couch. Perfect. Okay. Okay. I did not hear any adventitious heart sounds in the posterior or anterior. Breath sounds were clear and equal. If I had heard any adventitious breath sounds, if I heard wheezing, it would be high-pitched musical notes. And then if I had heard any crackles, it would be continuous popping noises. So now I'm going to be doing a peripheral assessment. So when looking at her upper body, skin is pink, which is proper for ethnicity, and there doesn't seem to be any edema, swelling. It's warm and smooth and dry. I'm gonna check for clubbing. Perfect. I'm gonna check for capillary flow. No clubbing, and there is no clubbing, and there. Capillary refill is brisk in under 2 seconds. Yeah, okay. So now I'm going to check her radial pulses bilaterally. Perfect. Radial pulse is +2 in amplitude and even regular. I'm then going to check the antecubital. All right. Antecubital pulse is +2, even and regular. All right, and then I'm going to have you put both legs on the ground. Okay. Legs are the pink with it for proper for ethnicity. There's no ulcers or varicose veins present. There, I'm going to check for malleolar and pre-tibial edema. So, pre-tibial edema, there is none present, and then malleolar. There's no malleolar or pre-tibial edema present in either locations. So I would then first listen to the femoral pulse, just in the hips, and that would be an amplitude of +2, even and regular. I'm then going to look at your popliteal pulse. Good. Amplitude is +2, even and regular. And then I'm going to listen to the posterior tibialis pulse. Okay, amplitude is +2, even and regular. And then lastly, dorsalis pedis. Alright, and amplitude is +2, even and irregular there. So now, I'm going to be doing an abdominal assessment on you. So can you lay down? Maybe put your head that way. Put your head that way. Actually, maybe put your head the other way. Sorry. Okay. So, first thing I'm going to do is inspect the stomach. The stomach is flat. The umbilicus is midline, and the skin is smooth and proper from this view. So first I'm going to auscultate the bowel. I'm going to start in the right lower quadrant, go to right upper, left lower. Alright, bowel sounds are normal active in all 4 quadrants. I'm then going to have you bend your knees for me, and then I'm going to palpate in the same order. Let me know if you feel any tenderness at all. Is any of that tender? Alright, there was no tenderness, and I didn't find any masses or anything, nodules or anything else unusual. I wouldn't do any deep palpations because I have to leave that for an advanced practitioner due to deep palpations can cause harm to the patient. I'm also going to listen for an aortic bruit, which I would have done when I was listening after the bowel sounds. And listening to that under the xiphoid process. With the bell. Okay, there was no aortic bruit heard. I'm then going to have you sit up for me, and I'm going to check for CVA tenderness. So do the same thing, put your knees on the couch. That's good. Yeah, okay. So let me know if you feel any tenderness right here. Is that tender? Tender enough? Okay, there is no CVA tenderness. So now I'm going to do the salivation and check the musculoskeletal system. So first I'm going to look at her shoulders. Her shoulders are symmetrical, and there doesn't seem to be any swelling or nodules or masses. Also, have you had any past surgeries? Okay, perfect. So then I'm going to have you move your shoulders around a little bit. Perfect. I'm just going to palpate. Alright, there is no crepitus, and there is no masses or nodules or increase in temperature. Alright. So I'm then going to have you go flexion to bring them up, extension, abduction, adduction, and circumduction. Perfect. She has full range of motion, full and active range of motion in her shoulders. And then I'm going to have you shrug for me. Good. And then I go abduction. Good. All right. And her muscle strength was +5 in the shoulders. So now I'm looking at her hips. Her hips are symmetrical. There doesn't seem to be any swelling or deformities in her hips at all. And then going to palpate. Is any of that tender or anything? All right, can you lay down for me? I'm gonna palpate. Okay. And there are no masses, nodules, or increase in temperature. And then can you move your head for me around? Okay. And there was no crepitus. So first thing I'm going to so you can actually move your butt. Okay. So can you go abduction? So one leg out. Good. Abduction in. Other leg. Abduction out. Abduction in. Good. And then I'm going to have you bend your knee and go in for internal rotation, then out for external. Same thing with the other leg. In, internal rotation, external rotation. Good. And then go in a circle. Perfect. Circumduction. Good. Other leg. Circumduction. Good. Okay. She has full and active range of motion in her hips. And then I'm just gonna have you press up against my, I'll do this at first, right leg. Good, press up against this one. Good, okay. And her muscle strength is +5 in her hips bilaterally, and then muscle strength +5 bilaterally in her shoulders as well. I would then perform hand hygiene, make sure that she is in a safe and comfortable position and has her call light on her, and then I would go and document my findings. Thanks.